I'm autistic, but this video isn't about that. Today, we're talking about something way less discussed but still super important: high-resolution anoscopy, or HRA. Ever heard of it? If not, don't worry, you're not alone. But if you have a history of HPV, abnormal pap smears, or certain risk factors, this test might be something you need to know about. So what is it? Who needs it? And most importantly, does it hurt? I've had this performed with and without a biopsy, so I'll share my experience on what recovery is like. Stick around because this info might just save you a whole lot of worry down the road. Alright, first things first, what is an HRA? In the simplest terms, it's a close-up look at the cells inside your butt. Yep, that's right. It's like a super zoomed-in version of a regular anoscopy where a doctor checks for anything abnormal, like precancerous cells, HPV-related changes, and other issues. Think of it like a magnifying glass for your backside. The doctor uses a tool called an anoscopy to hold the area open. Yeah, I know, it sounds super fun, right? And then they apply a special liquid that highlights any problem areas. If they see anything concerning, they might take a small biopsy for testing. More on that in a second. Who actually needs one of these? Well, if you're someone who has a history of HPV or abnormal anal pap tests, HIV or a weakened immune system, a history of anal cancer or precancerous cell, and certain high-risk behaviors that increase the chances of anal dysplasia, then your doctor might recommend an HRA. But even if you don't fit those categories, it's always good to be aware of tests like these because early detection can be a game changer. Would you ever get screened if your doctor suggested it? Let me know in the comments. This isn't a test you can just get at any old doctor's office. Usually a specialist like a colorectal surgeon, infectious disease doctor, or a proctologist performs it at a hospital or specialized clinic. You don't need to be knocked out for it, and it's done while you're awake. And the whole thing takes about 15 to 20 minutes. Now you might be wondering, is it painful? And my answer is, it depends. Let's talk about that. Okay, so story time. I've had an HRA both with and without a biopsy, and let me tell you, the difference is pretty noticeable, but still not a walk in the park. My most recent visit was a week ago at the time of this recording, and I'm just now feeling good enough to be able to sit down and to record this video for you. I'm finally back on solid foods, and I'll explain why I chose a liquid diet in a minute, but first let's go over last week's visit. My doctors in the past that have had to enter that region have all commented that I have a tight pelvic floor. This can be caused by a number of things, but mine is likely from the stress around the procedure being mentioned. To help with this, my referring doctor prescribed me diazepam 5 mg to take an hour before the HRA. Diazepam is used to treat anxiety, muscle spasm, and seizures or fits. It can also be taken to help you relax before an operation or other medical or dental treatments. I was prescribed a few of these to take a day before to see if I need an escort home after the HRA and to know how long the effects lasted. I found myself relaxed, but not too relaxed to where I needed somebody to help me get home. My appointment was for 9:30 Thursday morning. I took the diazepam 1 hour before the appointment and probably should have taken 2 or a little bit closer to the start time. I was relaxed but still a little anxious. The nurse presented me with the consent forms to sign, acknowledging that I know the reason for this exam and the risks involved. After signing and having my vitals taken, I was given a gown with instructions to place it with the opening in the back and to take off everything below the waist minus my socks. The doctor entered and explained the procedure and asked if I wanted him to talk me through it or just perform it, even though I had had this procedure done before and with the same doctor. I laid on my right side, bringing my knees up towards my chest like a seating position. Before the anoscope is inserted, the doctor performs a DARE, or digital anal rectal exam, by a gloved finger checking for any bumps. In my case, the doctor observed no bumps or abnormalities and proceeded to the next part. The anoscope is inserted and the vinegar and iodine solution is inserted for about 90 seconds via a soaked medical gauze. This helps the abnormal cells become more visible. After the minute and a half, the gauze-soaked solution is removed, and then the doctor takes a closer look using the special scope. If there are abnormal cells observed, then the doctor will perform a biopsy about the size of a grain of rice. This last visit was without a biopsy, and I'm instructed to return in a year to make sure things are still negative. It was uncomfortable, sure, but not terrible. It mostly just felt like pressure, like someone was inflating a tiny balloon in there for a few minutes. Afterward, I felt fine minus the muscles still contracting from when the scope was inserted, aka your butt is still trying to push out something that's not there. They warn you if this is your first time that you will have the feeling that you need to defecate, but you're advised not to within the first hour after the procedure. This feeling can be eased by soaking in warm water. The doctor sent me home with lidocaine and a prescription for ibuprofen 600 for the pain. I didn't use lidocaine because applying it internally was too uncomfortable to perform. I stayed on top of the pain management while awake, but the following morning, my first BM of the day was painful. I'm not going to sugarcoat it for you because every medical write-up online minimized the pain to, quote, some patients experience a mild discomfort. No, that was not a mild discomfort, doc. That was straight up hell. What I experienced that following morning was by far the second worst pain I'd ever experienced. Even with stool softeners, pain medication, and a liquid diet starting the day before the exam, that bowel movement was like giving birth to a 15-pound watermelon, even with only well-blended smoothies in my body to digest. I was sweating from places I didn't know I could sweat from. My legs and my entire body felt weak. I sat down in the shower rinsing off before returning back to bed all before sunrise. I say this as someone who works out twice a day, 5 days a week, and never skipping leg day. I didn't have the energy to make my husband his coffee like usual and spent all day Friday in bed sleeping. When I wasn't asleep, I was taking ibuprofen and soaking in the warm water. The warm baths really helped, and this next part is a bit gross, but if you've made it this far, you know this topic isn't an easy one without talking about the mess that comes with it. No pun intended. I'll include an on-screen timestamp to skip if you don't want to hear this really helpful but gross tip. Okay, are you gone? Good, now let's talk about it. To make defecating easier and less painful during this time, fill the tub with just enough water to cover your legs at a temperature that's warm but not too hot. Sit in the tub with your back facing the drain as close to the drain as possible. The warm water will relax the nerves and make the process 1,000 times less painful. After you've pushed it out, remove the drain stopper and say bye-bye troubles. Clean the tub and shower off like usual. Pro tip, remove the drain cover so you don't have to perform a waffle stomp. But if that was without a biopsy, how was that experience different than one with a biopsy? My last HRA was 2 years before this exam. I practiced my right to autonomy and told my doctor that I didn't feel comfortable with the procedure again just for them to do the exam, take a sample, and come back with a false positive or results that said I was in the clear, nothing to worry about. I was traumatized by that experience. Let's talk about that. Oh, buddy, the biopsy itself? Quick, and it felt like an internal pinch, but the after effects? That's where it gets real. The area is tender for a few days, and going to the bathroom, well, let's just say you'll want to take it easy. Although the doctors didn't recommend it, I suggest you do a juice fast during this time. If not, then at the very minimum, be mindful that what you put in your mouth has to come back out somehow. No spicy foods, nothing tough to pass or that has the ability to irritate the biopsy site on its way out, such as corn chips, no fried foods, and make sure you've got plenty of fiber. Narcotics aren't prescribed because of their ability to cause constipation, so that's why the medication for pain is just ibuprofen. The main difference I found with and without a biopsy was the extra week and a half to recover. This last time without a biopsy took me 6 days to recover. That is returning back to eating solid foods and being able to defecate without there being any pain involved. And though there was a little blood in my stool the first 2 times that I had to defecate, it cleared up a lot sooner. I'm not sure, I haven't reached out to the doctor to find out why there was some bleeding, but I'm pretty sure it was just all of the twisting and turning and the poking and prying that took place. The lidocaine was used as a local anesthesia, and again, checking the records and the report after my visit, there was no biopsy that was taken, so I'm not sure why there was some blood in my stool. However, as I said, the big difference is that with a biopsy, there was blood present, and it was for about a week. A lot less each time, nothing to be alarmed about. But again, it's not normal. It's not something that was my normal. But according to the medical professionals, that was completely normal because of the procedure that I had. Now, I won't say I have a high tolerance for pain, but I've also had dental work where with a hot tooth. A hot tooth is when the tooth resists numbing. I'd do that again. The pain during the recovery in 2023 is why I didn't have another HRA until 2025. So why go through all of this? Well, the main reason is early detection. HPV-related cancers, especially anal cancer, can be caught early with an HRA. And catching it early means way easier treatment options and a much better outcome. This test could literally save lives, which is why doctors recommend it for people with high risk factors. Even if you don't think you need it now, knowing about it means you can make an informed choice later. Searching for stories of people who didn't follow up with an HRA for years led me to a few Reddit posts that described a far worse outcome than the 2 weeks maximum recovery time I've experienced so far. There was one person who had to have several warts burned off, and the healing process was 4 weeks. Just enough time for the doctor to come back and remove more at their second visit. So as soon as that person healed, they had to go through the process all over again. This happened to them after a year of not treating an anal itch they noticed but were too afraid to have checked out by a doctor. They also reported that they hadn't had sex in 7 years before they noticed anal itching, and so in that 1 year time, a cauliflower of warts formed. Just one story like this was enough for me to keep my appointment and to get to the bottom of things, no pun intended, so that bottoming wouldn't be an impossibility for me in the future. There was another Reddit post from a 27-year-old assigned female at birth who identifies as female. Sorry, I just want to make sure I'm not offending anybody. This is already a sensitive subject. Subject, that's what I said. She tested positive for anal HPV despite never having anal intercourse. There was one guy in the comments who said he wished doctors talked about HPV as much as they talked about HIV prevention, because one can be managed with a pill a day and the other is HPV. Not all HPV causes warts, and the type that causes warts don't lead to cancer. Though from what I've read, wart removal can be painful to heal from. The sad reality is that HPV is like glitter and is the most common STI in the US. Most sexually active people will get at least one form of HPV in their lifetime. Most people acquire HPV shortly after becoming sexually active but have no symptoms. And most of those people, 9 out of 10, clear the infection, including the high-risk types, within 2 years without ever even knowing they had it. HPV can enter the body through mucous membranes such as mouths, lips, anus, and parts of the genitalia. There's over 200 types of HPV, and not all can or will cause cancer. In people assigned male at birth, the HPV is mostly found in the penile skin or the shaft. This again is why you don't have to have intercourse to catch or transmit HPV. Circumcision reduces the risk of HPV in men, also reducing the risk of HPV transmission from men to women. According to historical data showing Muslim and Jewish women are less likely to get cervical cancer. If you are a parent, no amount of Bible thumping or preaching the gospel is going to save your child from this glitter they are going to come in contact with. The vaccine doesn't cover all of the over 200 types of HPV. In fact, 9 is in the name because it targets 9 forms of HPV. 7 high-risk types that cause HPV-related cancers, which are 16, 18, 31, 33, 45, 52, and 58. And it also includes 2 low-risk types, 6 and 11. All children can get vaccinated for HPV, typically starting around the age of 11. The CDC recommends that everyone under 26 get vaccinated. And some people up to age 45 can get vaccinated if they weren't as children. That's why I'm having this conversation with you. I'm one of those people who came from a very religious background. My parents thought that abstinence was the way, and if I just tell you not to do it, you'll abstain and you won't do it. Never mind that when I was gay and they kicked me out of their house and all that stuff, that I was now out there to fend for myself. And had they listened to the doctors telling them, but that's again with Jehovah's Witness and their whole, another video, another topic, different day. Maybe I'll live stream about that. If you want to hear about that, hit me in the comments and we can live stream about it, but I'm not going to make a video specifically just for that. Getting back to it, what I was saying again, is that because some parents have certain feelings and certain views about sex and not wanting to face the fact that your kids are going to do this. You were once somebody's child. You still are, but you're an adult now. Your parents tried to do all the things to try to get you to not do the things that you did, but you still did them. And guess what? You still got some of that glitter on you. So do the right thing for your kids. Get them vaccinated, because even with just one vaccine, out of the recommended 2 doses, but again, just a single dose will be just as effective. So if for whatever reason, if you can't go back, you can't make your doctor's appointment, but you should be making your appointments. You should be seeing your doctor regularly. So I'm not excusing it. And I'm not saying that you don't need to get however many doses the doctor recommends. If you don't have a compromised immune system, then you'll only have to get 2. But if you do, then they might recommend 3. But as a parent, if you do this for your kid while they are still on your insurance, it'll be so much easier for them. As someone who's now 44, I was vaccinated for HPV when I was 42, I believe. I was 41, turning 42. So I had my first dose at 41, had my second dose at 42. It was given 6 months apart. But because of my age, I had to go through hell just to get the insurance to approve it, because they considered me to be past the prime when I should be getting vaccinated for HPV. According to insurance, they looked at me as though You probably already come in contact with it. Your body's already done what it was going to do. We're not going to pay for something just to be paying for it. So if you're one of those parents that's, oh, I can't wait till you get grown and gone, you get 18, you get out of my house, at least do them that favor, do them that solid. Protect them before you turn them loose to the world. The world isn't going to care about your kids the way that you are supposed to care about your kids. And as we've already discussed, it doesn't have to be intercourse. So all of the things that Catholics and whatever other religions, they think that they're doing, they're saving themselves for marriage so they can do everything but that, they're still putting themselves at risk. And while I'll apologize for my tangent because sometimes that's what happens, I will not apologize for the subject and the topic that we're talking about. It started off about HRA, but HRA, we got there because of HPV. So now that you know what an HRA is, are you feeling more prepared if the doctor ever suggests one for you? I hope this video answers some questions, but if you've got more, drop them in the comments and I'll try my best to answer. Again, I'm not a medical professional. I'm just a patient who experienced this procedure, and I wanted there to be some type of something that you could grasp onto, that you could find on the internet when you do your searches, like I did my searches, trying to find what to expect when I was going in for my HRA. Have you ever had a medical test that made you feel nervous beforehand? Tell me about it in the comments. I promise you're not alone. And if you like this, give it a thumbs up. And if you want more real talk about stuff that no one else wants to explain, hit that subscribe button. Thanks for watching and take care of yourself.